So thanks very much for joining us for this week's update on COVID and vaccines. It's the 17th of February. My name is Mike Dacey, and I'm the Chief Operating Officer of Riverside. With me is Cindy Williams, who's our Vice President of Pharmacy, and who together, working with the Health Department and all the great staff that work with her, has really been instrumental in helping in the vaccine rollout efforts across the region, not just at Riverside, but across the region. So Cindy, thanks very much for taking some time to talk with us. What I'm going to do is I got a few slides I'd like to show, and then Cindy, I think you have some slides that you can show as well. So let me just share my screen here and see if this works here, and share that screen, and then start the I have a few slides I just wanted to show, and then swap the presenting slides. So thanks. So this is just a couple of graphs that we put together showing the incidence of COVID hospitalizations across the region and across the state. This particular set of graphs is a set that shows the statewide data. So you can see, and these are each one on the lower axis, each time increment is a week. So you can see that the surge began almost a year ago now, and April began to really peak, and then we saw a decline, but then a real big upsurge over the summer across the state, and that was right after the 4th of July. And then we saw the really big upswing in hospitalizations here right after the holidays, and those have thankfully started to come down. But you can see the peak hospitalization numbers across the state were well over 3,000, 3,300 or so, and now they've started to come down, but they are still significantly above where even the summer peak was. And likewise, when you look at ICU hospitalizations, patients on a ventilator, very similar numbers across the state. Now, if you take a look at, this is the eastern region, taking all the other regions out, Northern Virginia, the central area out, just looking at the eastern region of Virginia, you see very similar patterns. So at the peak here, across all the hospitals in the region, there were about 800 patients just with COVID that were hospitalized, and about 160 of them or so were in intensive care units, and over 100 were on ventilators at the peak, and those numbers have also started to come down. So we think that's a combination of things. It's a combination of the fact that the holiday surge is ending. It's people continuing to do the physical distancing and wearing masks, and we don't know if there's any effect of the vaccines yet. It may be a little early, but certainly the vaccines will help as each week further goes along. Just to give some international perspective to this, when you look at doses that were administered across the world here, these are the different countries. So look at Israel. It's unbelievable what Israel's been able to do with vaccinations. Some of the Middle Eastern countries have done well as well. They've used the Russian and the Chinese vaccine. United Kingdom has had a big push, and they've done some things differently. They're just giving out one dose and then spacing out the time to the second dose by 12 weeks. And there's some early signs that may have helped them. Then there's the United States here, not doing nearly as well as Israel, but certainly on the upswing. And then likewise, if you look at data, vaccines administered per 100 people, again, Israel doing much better. Serbia has a close relationship with China, as it turns out, so they have the Chinese vaccine, and then the United Kingdom and the United States following. Fortunately, we've seen a real ramp up since the holidays of doses that are administered in the United States, a real significant ramp up from the time right at the first of the year. It was just 2 per 100 people, and then when you look right now, it's over 16. And likewise, daily doses administered in the United States up from 400,000 or so, now in excess of 1.6, 1.7 million doses yesterday. So this is very good. If people ask about the breakdown in the United States, it's about half Pfizer and half Moderna. And Cindy will tell you that the Pfizer vaccine is very difficult to handle because of its cold storage requirement. Moderna is a little bit easier to handle, but about half and half. And then when you look at total doses administered, because the United States has so many people, it's about 55 million doses, total doses administered out of 70 million that have been distributed. And then when you look at percentage of the people who have received at least one dose of COVID-19 vaccine, again, Israel, United Kingdom, been doing very well. In the United States here at around, today, around 12% of the population having received at least one dose of vaccine. And then this is the share of the population that's received two doses. And again, here in the United States, it's we still have a ways to go with that. We're about 4.5%. Now, by state, it varies widely, and there's a good story for Virginia to tell here. And I think, again, this is due to the collaboration between the health department and the private sector, government and private partnerships, and getting this done. And, you know, what people have probably know is that some of the states that have done the best have been the most surprising. So West Virginia, for example, you know, again, huge, number 2 in the country. Alaska, huge geographic challenges there, number 1 in the country. And Virginia, when you look at it right now, we're number 11 in the country, up from significantly lower levels over the course of the last month, thanks to a close working relationship between the health department, health systems, and other private organizations. So other states not shown in this list are really lagging, and those are states, particularly in the Northeast, where people have the states there have tried to do it all on their own without some public-private partnerships. This is another example of a share of people that have received at least one dose, and again, in Virginia, that number as of yesterday was 12.3% or so. And this is a very important number here. When you look at this slide, it's the share of available vaccine doses that have been sent out to each state that have actually been used. And right now, Virginia is number 3 in the country, about 86%. I'm sorry, number 4 in the country at 86%. And so very, very good story to tell. And I think things are only hopefully going to get better from there. But 86% of all vaccines distributed to the state have now been given out. There are some states, other states, if you go down this list, you know, that struggle to get to even 60%. So that's been very, very good work on the part of literally hundreds of thousands of people working across different state agencies, different private agencies to get things done. And this is just a summary of this. And so if you look at this, out of 8.5 million people, 6.8 million now eligible to get the vaccine because of age or coexisting conditions. Virginia has now the priority group is almost 3 million that's now being addressed, and Virginia has given out about a little over 1 million first doses administered, and they've got another. We have another 1.2 million doses scheduled for delivery in coming over the coming months. So pretty good story for the overall state, and I think that, you know, when we look at the efforts that's been undertaken, it showed gradual but yet steady progress, and particularly over the course of the last month or so. But Cindy, maybe you could spend just a few minutes talking about now what more locally, what particularly Riverside has done to try and contribute what we could to these efforts.
Yes, absolutely. Thank you, Dr. Dacey, and thanks for giving me an opportunity to talk about Riverside's story. So through today, through 10 a.m. this morning on the 17th of February, Riverside has administered around 48,000 total doses, and that includes administration to just under 37,000 individuals. And you can see from the graph here that, you know, we started back in mid-December. That's when we were in phase 1A, primarily healthcare workers. And then as we entered January and went into phase 1B, you can see that the vaccine efforts have expanded. I will say that we saw a big spike towards the end of January. That was a one-time large allocation of vaccines we received from the state. That was a sort of one and done. And you can see that the first doses that are represented in blue have dropped off a bit. But we still remain very busy. This week, next week, and the following, we are still continuing to focus efforts on getting first doses administered. We are also focusing on completing those second doses in the series, as Dr. Dacey mentioned. We also have been collecting information around the demographic makeup of those that have received vaccine at Riverside. We continue to see a larger percentage of females than males. Some of that may be driven by the healthcare workforce, where you have a larger number of females because of the impact of nursing and other professions. But even as we've expanded into those 65 and older, we have continued to see that divide. We also were tracking by age, and while early on, the majority were under the age of 65 because they were healthcare workers, you can see since we've gone into phase 1B that well over 2/3 of what we have administered is to that higher risk population, those 65 and above that have been serviced by Riverside. And then as we look at race, there's been a lot of discussion around equity of vaccine, and we certainly are focused on ensuring that our vaccine is being administered in proportion that represents the communities that we serve. And in a few slides, I'll talk a little bit around some community efforts that are focused specifically at vaccine equity that Riverside has planned over the next couple of weeks. So I wanted to talk a little bit about some of the support that Riverside has given to our communities in addition to those that work within our organization. So as we looked at phase 1A, which did start in mid-December and actually continues till today, Riverside has vaccinated approximately 10,000 healthcare workers. About half of those, 50% of those that we vaccinated, were not employees of Riverside. So this is one way that Riverside has supported our communities. We have opened up our clinics to those that are from non-affiliated medical groups, dentists, community services boards, school nurses, and other healthcare workers. And we do feel that support of our communities has been very important. We do have the ultra cold storage for Pfizer vaccine, as Dr. Dacey referenced earlier, that has put us in a unique position to be able to receive vaccine. And we do want to make sure that we are providing support of our communities. As we've gone into phase 1B, which does include essential frontline workers, as well as those 65 and older and those with pre-existing health conditions, Riverside is also supporting our communities. We have held multiple events to support school districts such as Gloucester, Newport News, York County, and the Eastern Shore. Some of them have been solely efforts of Riverside. Several of them have been collaborations with the local health department and other community partners. But we do want to make sure that we are supporting those frontline essential workers in our communities so that they are also protected, and most importantly, as it relates to the school districts, that our children can get back in class. The other part of phase 1B that we've been working on has been in those 65 and older. And so under that phase, under phase 1B, we certainly have been providing vaccine to our patients, but we're also supporting a number of community efforts. And those efforts have been in collaboration with local health departments and community partners. I'd like to focus on a couple that we have coming up over the next 2 weeks that are specifically focused on vaccine equity. This Saturday, we have a clinic that is scheduled up in the Middle Peninsula at our Gloucester Hospital. That is a partnership between Riverside, the NAACP, and Three Rivers Health District. We also have a clinic that is scheduled in King William County on Monday, the 22nd, and again, is a partnership with the health department, Three Rivers Health Department, and Riverside Health System. And then I think very exciting is a new development where we are partnering with a number of community organizations to provide vaccine clinics in Southeast Newport News. We plan our first clinic in that area on the 27th of February, and we'll have recurring clinics to provide vaccine in that area over the next weeks and months to come. This is a wonderful collaboration between the City of Newport News, the Health Department, Achievable Dreams Academy, Newport News Free Clinic, and others in the community, including faith-based leaders. So we're really looking forward to standing up those vaccine clinics starting next week and offering them as we come into the spring and beyond. So those are my comments related to our vaccine efforts at this point.
Cindy, thanks very much. I appreciate that. Maybe just have a couple of questions. as we used to say in the Army, no battle plan survives contact with the enemy. And the enemy this week, it seems to be the weather. Is that true?
Yeah, we've had a lot of issues with the weather. I'll first start with the inclement weather last weekend, and I'm sure Riverside was not the only one impacted by this, but we had a number of clinics scheduled for last weekend. In fact, we had almost 2,000 doses of vaccine scheduled to be administered last weekend. And unfortunately, because of the weather, we ended up canceling or postponing most of those clinics. And so we have worked very hard. Those in the medical group and other parts of the organization have worked very diligently starting last Friday to reschedule all of those individuals. And I'm happy to say all of those individuals that had to be postponed last weekend will receive their vaccine by this Saturday. The other thing that we're seeing is delays in vaccine delivery. Because both the Moderna and the Pfizer vaccine have very specific cold chain requirements, both of them are frozen, whether it's just regular freezer with Moderna or ultra cold with Pfizer. And some of the hub airports for FedEx and UPS and others being heavily impacted by the storms, there was a decision to essentially just not ship the vaccine earlier this week and last week and early this week. As we well know, Virginia's not the only one with inclement weather. I think we've all seen what's going on down in Texas and some of the other Southern Belt states. And so that's caused some disruption this week with a number of organizations having clinics planned and having to cancel those clinics or postpone those clinics because essentially the vaccine didn't show up. And so I think those are really the two dynamics. Our vaccinators and our community being able to get to the clinics. And then secondarily, do we have the vaccine to administer because there have been some delays?
Right. Well, thanks, Cindy. That's important. I mean, hopefully the weather will get better soon. But people often ask, well, why can't you just hold the clinics and then if the people show up, they show up. If not, we get rescheduled. Why can't we do that?
Yeah, well, I think there's a couple of things there. One, I think, first and foremost, we want to make sure that all of those attending the clinics are safe, right? And we do know right now with us doing clinics that are 65 and above, many of those individuals have mobility issues. So we certainly want to be cognizant that if we've got individuals that are using, assist devices such as walkers and canes, we want to have a safe environment for them first and foremost. But secondarily, these vaccines, they need to be thawed. So for example, the Pfizer vaccine, once you remove it from the freezer, it's only good for 5 days or 120 hours to be exact. And so last week, we had to do a lot of planning as we went into the weekend. If we had taken that vaccine out of the freezer for those 2,000 doses on Friday morning, we really did risk the issue that we may have wasted vaccine. And with the shortage of vaccines generally, we certainly cannot afford to waste a single dose. So I think it's really the safety of our patients and our community, and also ensuring that we don't put any vaccine to waste.
Yeah, no, I think that's right, and you don't want to waste anything. And you all and the people at the health department have done just an excellent job with that. I mean, I remember when the governor's office called going back a few weeks ago, and they found those extra 60,000 doses that were allocated for nursing homes that they didn't end up needing for CVS or Walgreens, and the governor's office asked if Riverside could give out, what was it, 8,600 or so in a week, and you all were able to do that very, very efficiently. Didn't waste anything, so that's great. What do you think about supply? I mean, when do you think supply will increase? There's a lot of discussion and debate about that. I don't know if anybody really knows. What do you think?
Yeah, I mean, I think, again, this is if I had a crystal ball, right? So, what we do know is that the Johnson & Johnson vaccine is going to be reviewed by the Food and Drug Administration next Friday, the 26th of February. So if that's approved, they should start shipping a very limited supply. I mean, they won't have a lot to ship immediately, but a very limited supply in March. And I know at the state level, there are discussions on the best way, the best population for that Johnson & Johnson vaccine, since it is a one-dose vaccine, but it is different than the vaccines that we've seen to this point. Pfizer has also stated that they have been able to increase production or reduce the time it takes to produce the vaccine. So, my guess would be as we go into April, I think we will start seeing increased supply. I still believe it will not be what we need to meet all of the demand, but I think we'll be in a better place than we are today. I think specifically February has, other than that one time, sort of bump in allocation we got, in late January, February's been a very tough month. There just hasn't been enough vaccine at the federal or state level. And I know that's left a lot of individuals very frustrated. But I do believe that by the time we get into April, we should see some relaxing of that, and we should see a better supply chain. And as more manufacturers, there are several other right behind J&J that we expect will bring information to the FDA in March. So if we have those players in the market by April, that will assist as well.
Yeah, and to the vaccines, there's a lot of concern over the United Kingdom variant, and was it the South African one, and then the Brazilian variant. What does the science say about vaccine efficacy against these new strains?
Yeah, so, what we're seeing, at least for the Pfizer and Moderna at this point, is that while there might be a slight reduction in efficacy, they're still seeing good efficacy against the strains that have been identified. Some of the other vaccines that are under development still that have not been brought to the FDA have had some challenges with the South African variant specifically. I do know that the pharmaceutical manufacturers are continuing to look at the variants and whether there may need to be a booster type shot at some point in the future if they see that the vaccine efficacy. But what I will say is, even with the reduction with the South African that's been seen with some of the vaccines still in development, it's still showing greater than 50% efficacy. And I think we have to think back, initially the FDA said it would approve any vaccine that showed at least 50% efficacy. So we've been very fortunate that Moderna and Pfizer came out of the gate above 90%. And it looks like J&J is going to be a very similar number, around 90%. So I think we've been a little spoiled, if you will, with this really high vaccine efficacy, which was really well above what we thought we would see.
This will likely be a yearly or every other year event for people to get this vaccine, you think?
Yeah, I think that's what they're thinking. We have to remember that, the vaccines only went into clinical trials last summer. And so they continue to track those that have been vaccinated and, track for, did they at some point contract COVID disease after being vaccinated? If so, was it a mild, moderate, severe case? So all of those things are being tracked over time. And I think it's that tracking of, those that were in the study and now subsequently those of us that have been vaccinated that will tell the story of how long we believe that immunity is going to last. But I think the idea is that there would be some type of, whether it's called a booster, whatever that's going to look like. I do believe there will be revaccination that will be required in the future.
Right. So, and I know that Riverside has accepted delivery of vaccine for a lot of other groups and organizations, and you redistributed that vaccine to them. Can you tell me what groups of patients are we specifically giving the first injection to, and what's the anticipated supply of that over the next couple of weeks?
Yeah, so, to your point, because we do, we're blessed with having the ultra cold freezers, which allow us to handle Pfizer, which is not typical even in our market. We have received vaccine for other hospitals. I think it was Dr. Dacey that decided to buy those freezers back in August. So we were proactive and blessed from a pharmacy perspective to have those. So we have received vaccine for other hospitals that did not have the ultra cold storage. We have received vaccine and redistributed for physician offices. We've given some vaccine to the community effort at CNU that's been targeted at school employees. And also some free clinics in some of our markets. And so, we continue to look at how we can support our community if it's not with actually administering vaccine, with at least receiving, storing, and then redistributing the vaccine. So we've done quite a lot of redistribution. As far as, where we're focused right now, most of our internal efforts are on those age 65 and above, whether that be through our own medical group or whether it be through community efforts, like I mentioned in Southeast Newport News and some of the other communities. In fact, one of our clinics up on the Northern Neck over 2 consecutive weekends immunized around 400 individuals not associated with our medical group that were referred to us by the local health department. So we will continue those efforts. We're also continuing to look at, what are opportunities with, maybe essential frontline or healthcare workers that haven't been immunized yet, and how do we continue to support the health department and what their needs are based on vaccine availability. We're here to help.
Right. So it sounds like it's essentially a week by week analysis of supply, delivery, different events that are planned with the health department, some done within the health system, some within private groups. So it sounds like it's a week by week phenomenon. But you all have done a wonderful job, Cindy, and thank you very much for joining us. And thank you all for joining us. We really appreciate your time, and we'll be back to you with information as time goes on. So thank you very much.